Hi, everyone. Thank you so much for joining us today for Healthy Life's Grand Rounds. I am Dr. Kanda. I am a licensed clinical psychologist, and I'm the founder of Healthy Life. And I'm here today to talk about a topic that is very relevant to the mental health field, of course, but it is also relevant to healthcare workers and even people that unbeknownst to them, they had to really take a caring role in the pandemic. So this topic is about compassion fatigue and really truly what it is and what we can do to treat it as well. So I'll be giving a nice overview of all of that. So let me go ahead and share my screen. All right. You guys see the presentation?
Yes, we can.
Awesome. So the title of this presentation is It Always Better to Give Than Receive? And again, I think many of us are taught to be givers. That is why we're in this field in the first place, because we have a lot of love, a lot of caring to give to others, and that is very important in the healing process. But is there a point of diminishing returns? So here are the learning objectives that we have. I'm going to discuss what compassion fatigue is, how do you prevent compassion fatigue, and how do you treat compassion fatigue. If you look on the left-hand side of the screen, it says, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. All of these aspects are absolutely correct. But sometimes, again, we can care to the point where it can hurt us, right? So where is that line, especially as mental health providers? So in order to understand what compassion fatigue is, we first need to understand what compassion is. We can do that by looking specifically at historical figures who represent some of the greatest examples of compassion. Now, before I, of course, go over any of these examples, historical examples, we support all faiths, religions, spirituality, things of that. But we're just going to touch on a few key figures in history to give these examples. There are many, many more that this presentation would essentially go on forever if I had to cover all of them. But the first individual I have on here is Jesus. I have here a depiction of Jesus. It's a God of the Christian faith. And basically, when we think about his ultimate giving, his ultimate love, and his ultimate sacrifice of his own life for the suffering of others, there are immense depths, immense lengths that this man was willing to go to show compassion and love for all people. One of my favorite stories of him in the Bible, and I'm of course going to paraphrase and hopefully get it as accurate as I can, but it was when he was walking down the road with his apostles, and there were two blind men that were screaming out to him or telling him, please have mercy on us, please help us. And Jesus's apostles were like, get out of here. Like, leave this man alone. Don't you see he has things to do? And Jesus stopped and he talked to them. He communicated with them first, and he called to them and he said, what is it that you want me to do? What is it that you want me to do to help you? And he healed them. This is how the story goes, right? But first, through having compassion and love in his heart for those who are suffering a lot, not turning a blind eye to the suffering so many people experience, right? Now, this next individual, I have tried so many times to appropriately pronounce his name. So, Avalokittis is a Bodhisattva of compassion. Many people know him as the Dalai Lama. And he is the principal patron deity of Tibetan Buddhism. The story is fantastic on his evolution of becoming this reincarnated figure whose goal is to help alleviate the suffering of those in the world. In short, as he was on this path of learning how to have the ultimate levels of compassion for people suffering, the story goes that through trying to help the suffering of others, he had to grow 1,000 arms, multiple heads, just to try to capture the immense burden, the immense suffering the people of the world experience. So sometimes even depicted as like 11 heads. I mean, like these people, these deities that we look to, I mean, the level of compassion, the lengths, growing arms and heads, they're very powerful depictions of what people strive to do to help alleviate suffering, to help alleviate or to help bring compassion. Another, in the last example that I have here is Mother Teresa. If you do a Google search on Mother Teresa, you get hits like a life of true compassion. Like literally, like I just put Mother Teresa in and it just jumps to compassion. How to have Mother Teresa compassion, and Mother Teresa, epitome of compassion. There's a story of, I mean, so many countless stories of her going above and beyond in situations where others would turn a blind eye. Yet she was there for the poorest of the poor, those that are dealing with suffering beyond our comprehension. And she was there. She was sitting with them in their suffering to give them love and compassion. So who are we, meaning mental health providers, but givers of compassion and stewards of human suffering? So the three figures I just discussed, they have shown compassion on a divine scale. And it is so well recognized by others as being above and beyond what the standard is for compassion. In my study on this topic and personal experience as a psychologist, I know that all of us in the healthcare field are givers of compassion and stewards. Another word for stewards are agents, overseers, keepers, guardians, custodians. We are the keepers of others' human suffering. Now, Jesus, the Dalai Lama, Mother Teresa seem to have an endless well of love and compassion to give to all living beings. And it seemed so easy for them. Why is it then for us, it can be, our wells, we are not divine. Our wells dry up sometimes. And what I want, the intention of, again, this presentation is to really look at how to make our wells of compassion more sustainable. Because if you look at everything we went through in 2020 and how thankfully it seems like it's starting to dive down. We had to dig some deep wells. And now it's time for us as well. And oh my God, this could be for caregivers. It could be for people in HR. It could be in so many different areas, just as a method to keep our well of compassion going. So there are important terms that are brought up frequently in this literature regarding this topic. Now, one is obviously compassion fatigue. The other is vicarious or secondary traumatization. And then the next one is burnout. An issue with the literature out there right now is that there is complete inconsistency in the definitions of some of these terms. So I wanted to define them so that you have an idea of where I'm coming from on this topic. So compassion fatigue is a formal caregiver's reduced capacity or interest in being empathetic or bearing the suffering of clients. And it is the natural consequent behaviors and emotions resulting from knowing about a traumatizing event a person experienced or suffered. It's almost experiencing their trauma as well through their eyes, right? So it basically tiring from overextended caring. And it specifically involves the relationship between the provider and the patient as well. The next one, vicarious or secondary traumatic stress. So again, looking at some providers, healthcare providers, mental health care providers, and other people in different areas, like I said, caregivers and other areas. There is an empathetic engagement with traumatized individuals, and it requires the professional to hear about the traumatic experience and the dramatic reenactment of these experiences. But when we are with the client, we are simultaneously experiencing that emotion that person is experiencing. So there is this emotional processing that we ourselves on a different level experience, but we need to be aware of that because again, they have trusted us as being stewards of their pain, stewards of their emotions, right? Okay. Burnout. So burnout is a very extreme form of compassion fatigue. It's a loss of interest in the daily care of patients because of the burdensome experiences. It's a form of mental distress that arises from the clinician's interaction with the work environment. It includes feeling of emotional exhausting cynicism, depersonalization, and a low sense of personal accomplishment. And this can take some time to move past. It could take a lot of time and a lot of work to heal from something like this. So again, to rephrase, why would I talk about what these things are? Because again, we are mental health providers. We need to take care of ourselves first before taking care of others. So there's a story I came across in my research for this topic. And basically what it is, it's from a social worker's perspective when they were in their training. And I'm just going to read directly from what this individual experienced. So her name is Tracy. And based on what she wrote, this is what she said. So when I was a young counselor just out of school, I took a job at an alternative school. I provided crisis intervention and behavioral therapy to children who are unable to succeed in normal educational environments. One of my clients was a 6-year-old girl who had been repetitively sexually abused and had been bounced around foster homes with her aggressive outburst. After one particularly bad day of her active flashbacks, I found myself sitting in my clinical supervisor's office in tears. She asked him, "How do you do it?" She continued to say to him, "I can't sleep without thinking about her, about all of them. How do I deal with it?" He turned around to me, slammed his briefcase shut. He said, "Like that. Latching the locks shut. You just have to walk away. If you can't do it, maybe you're in the wrong field." And she goes on to describe how she hated him at that moment and suddenly felt as if all of her teachers had betrayed her for not letting her in on this secret. Why hadn't anyone told me that this job would hurt so much? And the truth is that he is wrong. That supervisor that she had is incorrect. We are humans. We are sensitive humans who go into this field for a reason. And sometimes it is very difficult to shut it off. That's when we know that's a sign something else is going on. We need to consult. We need to reach out to those who are around us and support each other so that we can continue caring and loving the people that have trusted us to help them. So with COVID-19, I know it's not shocking with the things that have happened. This is a big concern right now. It's for a lot of different fields. This was written very early into compassion fatigue, and there's of course a risk of burnout. There's not enough guidelines out there that really can help guide professionals on what to do when they feel this way. So at this point, what I want to do is talk about how to identify compassion fatigue. So just like much of anything else we talk about, if it's anxiety, if it's depression, compassion fatigue as well has cognitive and emotional components of it. Cognitive meaning your thought processes around it. So your cognitive symptoms could be like apathy, could be difficulty concentrating, perfectionism, like overly being obsessive about a component of what you're doing, which then could lead to over stress. Like no one can be perfect, right? Emotionally, a person's going to be feeling guilty, like I'm not doing enough. No matter how fast I run across that floor in the hospital, I'm not doing enough. No matter how many patients I see for therapy, I'm not doing enough. Feel angry, sad, numbness, or helplessness. So behaviorally, difficulty sleeping, appetite changes, and even a common symptom of PTSD, which is hypervigilance. It's being on guard. Physically, it could be your fight or flight system going into overload, increased heart rate, difficulty breathing, sweaty palms, things of that nature. So it's just one thing to actually know what it is. And covering the different facets of what it is, but it's a different thing to know of, has this affected you as an individual in your work? And I encourage all of you to take a look at this presentation, and it's a self-test. You could score it yourself. You don't need to be a clinician to even score and take this, but just get a sense of where you're at. Because if you are feeling that way, this is an opportunity for you to reach out and get help so you can continue to do the thing that you were willing to invest so much time and effort in, and that's in our case, therapy, right? So it's actually pretty reliable and valid too. So I looked into that component. So how do we prevent compassion fatigue? It's the next segment here. This term, work-life balance, it makes me laugh because everyone's like doing this work from home thing, and it's the separation between work and life can be really hard to maintain sometimes. There's no easy answer for that. But as much as we can, it's having a life outside of our job. All of us. That's what work-life balance is. It's having activities, hobbies, things that we enjoy outside of what we do for therapy, in our case, of course. The other component that really helps is just being assertive with what your needs are. Now, assertive, of course, does not mean aggressive, but it also implies that the person might be pretty passive on what their needs are. It's okay to identify, I need to take a day off, or I need a break. I need to schedule less patients a day, whatever it is. Assert what you need to make sure that well is being refilled. Now, organizations can teach individuals that are susceptible to this on how to set boundaries or when to say no or say I can't. But I mean, it's so much easier said than done, right? Like it's not like us as providers, we know these strategies, but at the same time, it's very challenging to implement certain things that practice what we preach is what I'm trying to say. It's not always easy to do that, but it's important to remember that we still need to do those strategies that we recommend to those individuals that we help. Other aspects, so coping skills, creative expression, nutrition. I mean, how often do you guys hear me talk about the relationship between mental health, physical activity, and nutrition? You guys are gonna get sick of me talking about it. But what we eat, how we are caring for ourselves, and these times where we have to dig deep to give people what they need so that they can emotionally heal. It's using those coping skills, through meditation, through relaxation, through, oh gosh, music, whatever it is, you name it. Creative expression, I guess music can fall into that, painting as well. There are so many things we need to make sure we're maintaining out of what we do for work. So how do you treat it? If you go through and you take that test, and again, I encourage you guys to follow that website, go on there, download that questionnaire. And if at some point in your career, you're kind of thinking that's what's going on, you'll know now that you need to start getting some care for that. And I've outlined several different methods here of what you can do to specifically help with that. Okay. Treatment of compassion fatigue, journaling. I mean, again, I think of strategies that we recommend to others to help themselves. It's us when we're wounded, when we have emotional wounds to tend to, it's doing those same strategies. So journaling, gratitude journal, focusing on the things that, despite you feeling overwhelmed, what are those things that you are grateful for? What are those things that are important to you? And doing things like this can really help us shift our view from seeing so much negative. And there are plenty of things that are out there that can be negative. But sometimes when we really just focus on that, we neglect all the beautiful and wonderful things that are given to us that are a lot of times just free, right? So taking time to journal, to express your gratitude daily, if it's writing in a gratitude journal or if it's just writing a thank you card, those things are awesome. There are so many different support groups out there. So many. It's taking that step of joining a support group. It doesn't matter if you're a caregiver, it doesn't matter what field you are in, a therapist, healthcare worker, there is likely a support group out there for you that can help you on your own healing journey. Medical doctors need medical doctors. Therapists need therapists sometimes too. And sometimes if you feel like you're helping people so much, or you're doing most of the work therapeutically, that could be a concern with boundaries, right? That could be something else emotionally. Maybe you see a client stirring up things from your past or whatever it is. If you're having a hard time with compassion fatigue, there are providers out there that can help with that. And the same resources apply out here. Psychology Today, Good Therapy Den, Healthy Life, of course. So, and you can also go through your insurance provider to see who is in network to start helping you as well. Self-care. Now, in the treatment of compassion fatigue, self-care is one of those things that can be used as a part of treatment, but it is also something that can be used in the prevention as well of it. So this broadly, if you start noticing is you're going through maybe some of these symptoms of compassion fatigue, that you have yourself walked away from some of the things that you do to care for yourself, that in itself is a sign that you need to get back on that horse and you need to start making your health, mental health and physical health, a priority. So there's many different kinds of self-care out there. There's emotional, there's practical, physical, mental, social. There are so many different types. So emotional self-care, they're basically activities that help you connect. So like seeing a therapist, using a journal, creating art, playing music, right? Practical self-care, there are tasks that you complete that fulfill core aspects in your life in order to prevent future stressful situations. So this could be like budgeting, taking professional developmental classes, organizing your closet as well. Physical self-care, going for a walk during lunch, doing 30 minutes of yoga, sleeping 8 hours a day. They're just things that improve your well-being and your physical health. Mental health self-care, it could be an activity that stimulates your mind or your intellect. So this could be reading a book, solving a puzzle, playing chess, going to a museum, things like that. Social self-care, very self-explanatory. See your friends and see your family. Spend time with people you love. Most of the time, those individuals will want to make you better. Now, they don't want to make you better. Maybe they're not the best people to go to for that social self-care component, right? For spiritual self-care, they are activities that nurture your spirit and allow you to think bigger than yourself. So thinking beyond yourself, finding that higher power through things like prayer, meditation, or if it's a temple or a church, time in nature, right? It's time essentially for self-reflection, to focus on what is it I can do to improve my life. There are so many books out there about this topic. I've highlighted just 4 ones that really have stood out to me in my study of this. It's a topic that I wish started in grad school in terms of us receiving training on. because in order to be good clinicians, we need to care for ourselves. And we are not above having mental health concerns, physical health concerns, having compassion fatigue, whatever it is. We have to care for ourselves. There are podcasts and videos, countless beyond what I have listed here. TED Talks, a decent number of TED Talks on this topic. So this resources are out there, and you can go and take a look at some of these links or just Google some of these things that I have on here. Okay, so just reviewing again some of the learning objectives that I initially spoke to you about. So I've discussed what is compassion fatigue, really diving into what is compassion first, and then the things that we can do to help prevent compassion fatigue, and then treatment for it as well. So I hope that this has been helpful. Again, this was intended for, therapists at Healthy Life, but also I wanted to put this out there because, it's been a tough year. There's been a lot of loss this year. I think a lot of us had to dig really deep in compassion to give to people in ways that we never had to do. A lot of people lost loved ones. So having to dig and give compassion in a number of ways that we hadn't before. So I hope this is helpful, obviously, not just for the therapists here at Healthy Life, but for other individuals as well. So if you ever want to learn any more information about this or would like this PowerPoint presentation, you can reach out to info@healthylifechicago.com or use any one of our methods to connect with us on our website at healthylifechicago.com. Thank you so much for taking the time to listen to this presentation. I hope it's been helpful.